Can you state your name, position, and where do you work?
My name is Lynn Inzarella. My position is substitute PRN physical therapist. I work at a variety of clinics in the area. And if you need some of them to be mentioned, I can tell you that.
Yeah, I'll take some.
Okay. I work at all 4 of the clinics owned by ACTS. There's one in Broussard, one in Delcombe, one in Lafayette, and one in Scott. I work for Pat Boulay. I work for Scott Oye in Abbeville. And that's about it.
Yes, ma'am. So how long have you been dealing with physical therapy? I've been in the field.
45 years.
Do you regret any decisions of going into physical therapy or no?
Not at all. It has been a wonderful career. And for the last almost 20 years, I've done that PRN type work, and it gave me a lot of flexibility when I wanted to work. And if I didn't want to, I didn't have to. And so that was a wonderful thing. I love what I do and I love doing it, but I don't want to do it all the time anymore.
Oh, yeah, exactly. Been in it long enough, huh?
Yeah.
And where did you attend college and what degree did you seek for it?
Well, I went to, since I've been in here 45 years, that means it was a very long time ago when I was in school, 1972. And I went to the University of Mississippi Medical Center for my degree. And at that time, the only degree was BS. And, then as the requirements started adding on, wanting to be master's degree and PhD or DPTs, I had the option to go back to school and get them, but I was grandfathered in. I think the expression is I was able to continue practicing.
Okay, since you were there before all that was instated and everything?
Yes.
Okay. And then another question is, what should I focus on while I'm in school for physical therapy?
The first thing you want to do is be sure and look at all different areas of PT, because there is so much out there, so many different types of fields. Pediatric, I imagine you're thinking sports, but you may get into a little setting that you love much more. And I also think that a physical therapist is better served if they do some hospital work, because you see so many more types of patients.
You see different patients than you would if they came to you.
That's correct. So there's a lot to be gained by that, even if it was just a short time, or even if it was just one of your residencies, then that might be enough for you.
And if you could do one thing different while you were studying physical therapy, what would it be? Like while you were attending college and everything?
Okay, well, I probably could have been a more serious student. And I'll tell you this about me. I was, I was interested in doing a good job, but I started seeing a friend of mine who every patient she worked on, mainly we were doing manual therapy at this point, every patient she worked on walked out feeling better. And I was going, I think I would like that.
Yeah.
And, I was doing appropriate PT, but I went to school before the University of Mississippi even had instructors to teach manual therapy. I mean, isn't that crazy?
Yeah.
So they taught us some hand therapy and arm, up to the elbow. And that's all we learned. Nothing on the neck, nothing on the back. And so I had to start getting that school of thought, by doing CEU education. And so I wish that hadn't been true. I'd have been smarter at the beginning.